Hello, and welcome to another episode of the Healthy Mind Chat, where health and communication intersect. Here we speak about health and healthcare and everything surrounding it. My name is Hasan Ali Khan. I'm your host. And firstly, I want to thank you all for watching my pilot episode with the great Deidre Jackson, where we discussed, uh, rather, we reflected of the year gone by and the impact of COVID-19 here in one of the suburbs of Chicago and how it impacted minority communities here in Chicago. And it was an amazing discussion. So thank you again for watching that. One thing I didn't really do in that video was to really give certain details about myself, and I just want to quickly take that opportunity to introduce myself to all of you, for those of you who don't know me. So very quickly, I was born and raised in Saudi Arabia. I am actually Indian by nationality with Pashtun ethnicity. My educational pursuits took me to the UK, then to the Caribbean, and now I am here in the US, where I recently graduated from Northwestern University with a degree in master's degree in health communication. I'm currently also pursuing a substance abuse counseling degree from Oakland Community College here in the outskirts of Chicago. And I am also preparing for US licensing medical exams, hopefully to be a doctor and practicing doctor here in the US. And in the past few years in particular, I've been able to travel around and just generally been able to experience healthcare both as a recipient of healthcare and as well as a provider of healthcare around the world. And especially since being here, I've had very important conversations, very interesting conversations, and to experience healthcare in America, where we're told is one of the most advanced places to be, and yet we see a lot of discrepancies and similarities with what is being portrayed and what we experience. Many good things as well as many questionable things, many things that leave us with a lot of questions. And as a health communicator, I think one of my jobs is to be able to have these conversations with you in public, and to discuss health and healthcare and what it means to be human and recipients of healthcare. And what is the best way to receive healthcare, and what does it mean to have quality healthcare at cost-effective ways? What does it mean to have access to healthcare? So all of these questions exist. We will also discuss in this podcast things, what we call social determinants of health. So what are the things that allow us as individuals and as communities to be healthy? And here we speak about economics, employment, education, and many other things at the ground level that allow us to be healthy. And as someone who's, I guess, an international person, one thing I would really like to do is to be able to compare healthcare in different parts of the world, especially when we look at the developing versus developed, so-called developed world. Especially for us here in America, what does healthcare look like outside of these borders? And today is one of those opportunities. And today we're going to focus on a country that we don't necessarily usually speak about, associate with healthcare in positive ways, but everything COVID-19, many things surprised us, or what may have surprised us. And Senegal, a country that is in the west side of Chicago, west side, not Chicago, west side of Africa, was able to demonstrate with how was able to demonstrate some of the best healthcare policies during the time of crisis. Way back in, now it seems like eons ago, in September 2020, reports were coming out how Senegal was able to have some of the best preventative measures during COVID-19, which they attributed to very good health communication and health campaigns, including music videos, radio campaigns, and this is a country which has 7 doctors for every 100,000 people, and yet up to now it's only had 1,000 deaths. Senegal has a population of just over 16 million. 16 million. Its current cases at the moment is nearly just under 37,900. And during its peak, or the first peak at least, it was voted as the second best country out of 36 countries by Foreign Policy's COVID-19 global measure index says to be one of the best countries out there in terms of health prevention. So how does a country which we don't necessarily associate with the best healthcare in the world, how was Senegal able to do such a great job? And what is healthcare like in a place like Senegal? And to do that, I'm joined with a dear friend who he is British, but moved to Senegal to pursue his journalistic career. He is has been a journalist for various news outlets, including Al Jazeera, The Guardian, The Independent, The Telegraph. He's also worked for the Channel 4 Dispatches show, which is produced in the UK for Channel 4 News. And he's also the author of a very interesting book. Hopefully he'll be speaking about that a little bit to us about that, which is called Becoming Kwame Ture, which reflects on the life of the great activist Kwame Ture, who was an activist here in America about civil rights movement. And I think was Pan-Africanism was something that he was really passionate about, who then moved to Guinea, West Africa, and the book reflects that. So I would like to welcome Amandla Thomas Johnson, great friend of mine. Let me put this in gallery view so we can all see you now properly. Hello, Amandla, how are you?
Hi, Ali. Thank you for having me.
All right, and today you're actually joining us from the UK, is that correct?
I'm in London right now. Yeah,
London
my background is a view in Senegal, but I'm actually in London at this very moment in time.
Okay, yeah. Great. And Amandla, how long have you been living in Senegal now?
I've been living in Senegal for almost exactly 3 years. I actually arrived there on the 1st of April, 2018. So almost exactly 3 years.
All right. So you were there April 2018. You experienced life in Senegal for pre-COVID.
Yeah, and I've been there for the majority of the COVID pandemic. I was there from the start all the way up until December,
right?
Which is when I left. So I was there for the entire time, and I caught COVID when I came to London. Right?
Oh gosh.
It kind of gives you an idea of the sort of disparities that we're seeing across the world, right?
Wow. So, let's start there then. This is Senegal post Ebola, right? There was the Ebola crisis that happened, and here I know the messages that we got, here in America and in the western area about how we want to close the doors to West African countries that were affected by it. Senegal comes out of that. There's a bit of I guess a building moment, and then come 2020, we are now in COVID. What was happening leading up to the news? And because here in America, as I think in the UK, everything started late. We responded late. We started everything in March, where you had places like South Korea responding from January, and in December, where coronavirus actually had become a thing and exposed, and people were alerted by it.
Right.
What were the steps, or at least the steps that you saw in the public domain, that the country was doing in order to tackle the potential threat?
Yeah. So I think it's good to start off with sort of how Senegal is connected to the sort of global system. Obviously, this was a virus which started in China, and it sort of moved across the world, and it kind of moved across through global transportation sort of networks, basically, right? Now, one of the things about Africa is that it's not as connected to the rest of the world when it comes to global transportation. And so in actual fact, the virus took longer to sort of, to get there. And so African countries had a bit more time to sort of think. There wasn't this like overwhelming bang, we're just hit and we're gonna, we're gonna be overwhelmed. So one of the things Senegal did relatively early, and consider that the British government only really started to think about this in January, well, they shut down their borders. They closed their borders. Like no flights were coming in from Europe, especially because the early cases that we had in Senegal came in from Britain, from France, especially. Those sort of circuits. They shut down the borders straight away. Remember, this is a country that is really beholden to trade networks from Europe, from France, especially, right? But it took the brave decision and it shut down the borders. And then it had to then deal with the situation within the country. Now, as you said before, this is a country with 7 doctors for every 100,000 people, but it had some other advantages as well. As you said, Senegal had been part of the Ebola response. Aside from Ebola, in sort of tropical climes, there are other sort of infectious diseases. There's dengue, there's malaria, and so institutions there, such as the Institut Pasteur, which is an important sort of medical research, sort of center, have been alive, and people at times have been mobilized. The population at times have been mobilized to deal with these sort of issues. So what you then started to see was this sort of abundance of messaging coming out. Websites sprang up almost overnight. Communities were engaged. You had text messages going out to people. In Senegal, it's interesting that the role of music actually is very much part of the fabric of society there. And with hip hop music, rap music, that's seen as a way to communicate certain things. And sometimes the government will work with certain artists to communicate certain messages. So you then started seeing music in Wolof, which is the local language there. Rappers talking about sending sort of health messages through through their music and stuff. So the whole country was really sort of mobilized. And they also put in place a curfew, a sort of night curfew, which is from sort of they shifted it around, but it's from sort of 7 o'clock in the evening until the sort of 7 o'clock in the morning. And that's kind of how they sort of managed to sort of stabilize the numbers. They also prevented people from moving from one region to another as well. And these were sort of enforced with sort of like checkpoints and stuff like that. So they really sort of put down pulled up the drawbridge, so to speak, so that movement was sort of blocked throughout the country. I think it's important to realize as well, though, that Senegal is still a country where 60% of the people are living in poverty or extreme poverty, right? And people live on a day-to-day basis. So to have a sort of curfew in place, where you have people, street sellers who work in the evenings, or you have guards who are working, you have many women will sort of like have sort of stalls on the street where they're cooking dinner, and you go out and you buy your dinner. So this was also a source of tension because people couldn't work, right? And if you don't work today, you don't eat tomorrow. That's how it works over there. So there has been pushback as well against the measures, and there've been major protests which have turned even violent at times against the protests, because people have been suffering, and then this is a country where there's still significant structural problems. Not everyone has access to water, stuff like that, right? So it was still a difficult process, even though they've kept the deaths down, and we're talking about, at the moment, just over 1,000 deaths being recorded. And it's sort of like, I think when you look at case numbers at the moment, it's sort of just over 30,000. That's 200 cases for 100,000 people. That's compared to sort of like, I mean, in the US it's far higher. In Britain it's far higher, and much of the Western world it's far higher. so yeah, that's how Senegal managed to sort of keep a lid on it, basically.
Oh, brilliant! Thank you very much for that. So I don't think America ever closes borders,
Right. No,
right? As in,
yeah.
it, they would, yeah. Air travel continued, I think, throughout COVID,
Yeah.
and and then what we, at least here in America, had very mixed messages. Uh, Clearly, with the administration at the time saying one thing, or health experts saying another, and then and then I think at the practical level, on the ground level, your small community clinics were saying something, and your big hospital systems were saying something else. Um, so, and I think what you're saying is that health messages and coordinated health messages really had an impact. And I was reading elsewhere as well, like, from very early on, people started wearing masks and adhering to
Absolutely.
certain.
Even now, you cannot walk into a supermarket or into a sort of public place without a mask. I mean, you just cannot. In the UK you can do that, but there you
Right.
just cannot. And they just will not. They will not allow you in, basically. So
Right.
I think that's great.
So what you're saying is that it is almost a social requirement rather than just a government. It is socially now
Yeah,
a faux pas
yeah,
not to do it.
yeah. Exactly. People will point you out if you try and try and do something that sort of breaks the rules. People will.
That's very interesting. So
Yeah.
there's, because here, one of the reasons why we probably have uh different ideas is because there's a lot of politics involved. You have one
Right.
side of
Right.
the politics saying something, and another side of the politics saying something else.
Mm.
What's it like in Senegal? Was from the politicians' point of view, was that also coordinated, where they were all behind one certain message and policies?
From what I can see, that has been the case. That there has been sort of unanimous,
Right.
close to unanimous sort of support
Mm.
for the response. And I think it's important also that Senegal is really a country where there is definitely a sense of community among Senegalese. And so Senegal is quite a diverse society, actually. When you sort of break it down, you start to look at sort of people's religious affiliations and ethnic affiliations. It's quite a diverse society, but
Right.
actually there is a sort of umbrella of sort of solidarity and sort of brotherhood, sisterhood that people tend to abide by. They help each other, they look out for each other. There's a sense of community,
Right.
overarching sense of community. And what I found interesting coming back to the UK was that you really saw actually that sense wasn't always sort of there, like that sense of social responsibility, wasn't necessarily there. So that's something that maybe has broken down in the West,
Right.
but in Senegal, I really felt there was a sense that people were sort of saying that we're all in this together, basically,
Right.
and we need to basically everyone needs to do their part.
Right. Okay. Then that's fascinating. It really is, and I think, it's similar things we probably were seeing out of South Korea,
Sure.
Singapore. We were seeing some of that in New Zealand. I think similar sort of sentiments where there's camaraderie, the social responsibility.
Right.
Even in a place like I think it's one of the states in India. I'm forgetting the state, where compared to the rest of India, this particular state, I think, run by Communist Party, actually.
Right. Yeah.
So,
It's down in the south, isn't it?
yeah, I think it's Kerala. I think.
Yeah. It is.
Kerala state.
Yeah,
They
exactly.
who did a great job in helping and maintaining the issue, COVID-19 and the impacts of it. So it comes down to this coordination, and here I think, at least in America, there is a difficulty because of its very capitalistic nature, that each hospital seems to be its own entity, and it was very interesting. In New York, there had to be coordinated efforts between all different hospital systems in order to deal with the sheer numbers and overwhelming numbers that was of cases that were happening in New York at the time, at its peak. But I'm not sure if that was practiced throughout the country in that way. So that's very, very interesting. And you touched on something which was the economic element to all of this and the
Mm.
impact. And I know recently as well, as, where I think because of the new surges of COVID-19 and possibly because of the new strains, new I think edicts about curfews have come back. And I
Sure.
think
Yeah.
and that
Yeah.
has led to certain term protests and whatnot, along with
Yeah.
many other, I think, background issues are happening. So
Sure.
if you can elaborate that, what has been the economic impact? And if you can give us a sense of on a day-to-day basis, as you've already probably have, but
Mm.
what are the people saying on the ground? What are there any what are the frustrations, if any, or
Yeah.
do they actually have a sense of understanding of why the
Yeah.
curfews may be there?
Yeah. I mean, I think people do have an understanding of why the curfews are there, but at the same time, Senegal has had just over 1,000 recorded deaths from COVID-19.
Hmm.
The UK was recording 1,000 more than 1,000 deaths a day. At even not even at the peak, right?
Hmm.
So so people understand that we need to do something about this to keep the numbers down. But I think there's a sense that, like, is our response proportionate to the risk, that we face? And I think that's something that people are thinking about. The risk, if we go on the numbers that we've seen, the risk doesn't seem to be, for some, doesn't seem to warrant this sort of lengthy, sort of night curfew. Um, and how does it affect people's lives? So, as I said, this is a country where poverty is off the chart, where unemployment is stark inequalities, and if you do happen to have a job, and sometimes it might be just one person in the family that is providing for entire household.
Hmm.
um then that is really your lifeline, effectively. When
Right.
I go to the shop in the morning to buy bread or eggs or whatever it is, people, you'll see people going in and they'll be buying like one sort of Maggie cube, these sort of
Yes.
one Maggie cube, and then sort of like a few cloves of garlic and a tiny little bit of oil, and so
Gosh.
that
Yeah.
you really get a sense that people are living day to day.
Mm.
And the curfew stops people from working, but it also stops potential consumers from being able to buy anything. And so in the part of Dakar, I live in Dakar, the capital city. In the part of Dakar that I live in, I would go in the evening to see a friend who runs like a small restaurant, and he will sort of be saying, people aren't coming here,
Hmm.
anymore. And these things are all interconnected, because if you can't work, you don't make money, and if you don't make money, you can't spend anything, and then
Hmm.
someone else who's relying on your as a client can't make their money. So it has a lot of knock-on effects,
Right.
basically. And I know that Senegal has had to sort of borrow money from international IMF and all that sort of stuff to sort of plug some gaps in its sort of healthcare system,
and
as well.
and and it was also used to, as far as I understand, to provide some kind of stimulus
Yeah,
packages
exactly,
to its
exactly,
citizens, right?
exactly. Yeah, yeah, absolutely. Yeah, yeah, yeah. That is also the case. Thanks for pointing that out.
Right.
Some of that money was did go to people deemed to be sort of the poorest of the poor. These would have been people in sort of rural areas. And my experience, the experiences I'm sharing with you now, are really about Dakar, which is the capital city. It's like
Right.
the most developed part of the country.
Right.
But I mean, it'll be completely different for someone who lives up in the countryside, where
Right.
maybe they're a friend of mine in Dakar, his parents are cattle herders, for example.
Right.
So because of COVID, they closed the market, right?
Gosh. Hmm.
And the market is the place where the cattle herders would make certain exchanges: milk, meat.
Hmm.
They'll sell their meat, milk, and all that sort of stuff. So you close the market, and that is really the I mean, I don't know how they've been able to survive.
Gosh.
That
Hmm.
is the centerpiece of the economic life.
Right.
So it's definitely been, people have really felt it, in the
Mm.
provinces. Yeah.
Right. But it seems almost, well, it is a world apart from here, where yes, we've had our economic issues here. The stimulus checks are just about coming in.
Mm.
Some during the previous governments, but now hopefully more so now. Um, but people still had their jobs. People, with working from home, uh, you know, yes, lots of people lost their jobs, but people still managed to find jobs here. So it's very interesting. Isn't, here in the West, we sometimes have a lot
Yeah,
to say, and but
right. It's easy to take for granted, but
right.
a lot of people exist on the margins in a sort of informal economy, right?
Informal economy. I know in India, before COVID, with the economic reforms that were happening in India, that we got to learn how much cash trading and cash working with cash was so important, as in India overnight changed its currency and its
Currency,
bills, and
exactly.
people
Yeah,
lost the ability to do business because not everyone has a bank account. People
yeah,
just, people keep the cash in the hand, and then they do their trading, and then suddenly you close the market, or not allow people to spend it. People lost their lives during, I know, in the India case. um so, well, thank you for elaborating on that. And then just one more part regarding COVID-19 in particular. How did the hospitals and the healthcare system respond to cases? Did they
mm.
have enough PPE? Where would you say the hospitals were really prepared, or did they suddenly find themselves overwhelmed? Did they have the ventilation systems, the oxygen
Mm.
systems? Do you have any
Yeah,
idea of what was going
yeah.
on there?
I think all of the measures, preventative measures
Hmm.
taken together meant that the weight bearing on the hospitals was minimal,
Right.
basically, right?
Hmm.
I mean, there's a limited number of ventilators in Senegal. I mean, maybe I can count them on my two hands, basically, right?
Right.
It's really kind of like that. I think actually if I remember correctly, it's somewhere like 50 or something like that. It's not, it's really
Right.
not that, not that many.
Right.
So I think all those preventive measures meant that hospitals weren't overwhelmed.
Hmm.
Um, People, but people, as people had to also improvise as well,
Hmm.
right? They had to sort of find, recyclable material, plastic,
Hmm.
perspex, whatever, and sort of make their own equipment. That was something that I noticed as well. They've also been developing the Institut Pasteur, named after Louis Pasteur,
Right.
the sort of pasteurized milk and stuff. So they also with a they've been developing this kit. This it's like a $1 sort of rapid testing kit
Hmm.
as well. So they've even been trying to make sort of like advancements which can basically be helpful to people who don't really have access to sort of big testing and stuff like that.
Right.
As I said before, they received some funding to invest in the healthcare system some more, but I think they've managed to cope. I think they have actually managed to cope so far. Yeah.
Nice, fascinating. Thank you for sharing that part. I just want to kind of now expand the conversation to something larger. As a journalist, as obviously as someone who follows the media, combs through the media, and probably has an analytical eye towards it. Here in the West, we, excuse the terminology, but there's this poverty porn, and Africa is seen
Mm.
even today in a certain frame, in a certain light. Um, what was it, Trevor Noah, who said that, describes that child with the fly on the face, and you know,
Mm,
and he had his comical yet critical take on that.
mm, mm,
Um, is that still the case? And is or are things changing? Uh, and if not, what is it that you think needs to change towards a fair, a more just portrayal of West Africa, of Senegal, just
mm.
of developing countries in general?
Yeah, sure. And I think that these countries, are there's a growing recognition of say African music, for example. I
Mm-hmm.
mean, African music has always had a sort of recognition, but now you have like Afro beats and
Mm-hmm.
other sort of musical forms which have really catapulted a lot of African artists into, you could say, the global mainstream, and they're talking about lives which are worlds away from the sort of the sort of pot belly baby with the flies landing on their on their lips, and I think that is really helping to sort of shift the sort of conversation. It's quite telling. It's also, the other thing is there's been extensive migration from Africa to the West, for example.
Mm-hmm.
In the United States, since 1990, the numbers of Africans arriving to the United States surpassed the numbers who arrived, who were forcibly taken and arrived as slaves. Right, so there's been a massive shift actually. You're seeing Nigerian communities, Ghanaian communities, Sierra Leonean communities sort of coming of age and producing literature, music, art, and it's the same in the UK as well. The sort of black communities there were sort of predominantly influenced by Caribbean migrants such as my parents, and now these days it's sort of Africans who are sort of the main sort of cultural sort of icons, and so all of that has an impact basically.
Yes.
On the stories that are being told and the conversations that are being had about Africa. But at the same time, there are old habits die hard, right? And we all remember the phrase from Donald Trump, when he called some countries shithole countries, and he was referring to a number of African countries when he said that. So there are these old stereotypical Orientalist, say racist, sort of ideas about Africa that still loom large in the popular imagination. And when my family, my family's from the Caribbean, as I said, when they hear that I'm in Africa, they always say, oh, make sure you're safe, and you take your is a war going, they get really worried, and I say to them, well, actually it's a lot less safe to be in parts of the Caribbean than it is to be in Senegal, for example. I mean, it's safe for me to be in it's safe for me to be in Senegal than it is to be in London. If you look at it's sort of like the figures for like violent sort of crimes and stuff. Right. What I found really interesting though was how the pandemic actually has it's kind of tongue in cheek, but it's also quite ironic that it's kind of allowed people to sort of like turn the tables. Africans have sort of turned the tables in how they're portrayed and how the West is portrayed.
Right.
So when there was an influx of COVID cases coming from France, one Senegalese newspaper, L'Evidence, pondered, is France colonizing Senegal? France being the former colonial power, so like sort of that because of playing words, colonizing.
Right.
And you had you had European. It was telling that there were maps that were going out. There were headlines talking about this virus is going to devastate Africa, and can they cope? And all the emphasis was on these poor Africans, and they're gonna be devastated by this virus. And it turns out that the inverse was has been kind of true. And the other irony was the fact that you have this phenomenon, for listeners are aware of sort of West Africans risking their lives to get to Europe. They're jumping on boats. Unfortunately, many are drowning, and many of those people are Senegalese. Senegal's lost hundreds of people actually in the last few months alone. To this. And by the way, that outflow of people has been compounded by the restrictions of the COVID pandemic. So that's also another a consequence of it. But so what was interesting is that these migrants were often being characterized as sort of swarms coming into Europe and all this sort of stuff. But when the borders closed, right, you had it was Africans who were closing the borders,
right,
to Europeans. So you had this sort of like inverse sort of situation where Africa is the safest place, the best place in the world that you want to be to see out the pandemic.
right.
And Europe, the West, other places, you know, that you're trying to flee from.
Mhm.
So it was an interesting you know, sort of reversal of fortunes that we saw you know, with the pandemic. Yeah.
Right.
Yeah.
Well, it was as someone who's, I think, lived on visas for the past 10 odd years, right? It was definitely a fascinating moment to see the
Yeah.
reversal. And like,
Yeah.
being a nomad and like being an outsider is just, you know, you can just sit there and laugh and watch, you eat popcorn, watch the show, really.
Yeah.
um, this kind of leads into another element which you mentioned about this, the idea of colonialism, right? And this West Africa and is a very fascinating place where, through friends and through current learning and whatnot now from some of the things that you've written recently, that the remnants of French colonialism is actually still quite strong. Is there still that is the presence of that colonialism still exists in a very uh, tangible way. Unlike, for example, in India, where there's no necessarily direct influence of the British, say in our economy and whatnot, intellectually maybe, but in Senegal it's quite different. And I think recently in your article in Al Jazeera, you spoke about the new protests that are happening, which seem to, in some people say anti-French, but it's trying to shed the new colonialism. So if you could elaborate on this, because I think, and the reason being is because to understand an economy of a nation, of a people, is to understand how they then deal with their day-to-day lives and things like employment, income, education are what we call social determinants of health. If what we learn from statistics, that those communities that have a great grasp of these things and are doing well at the ground level are probably communities that will be healthier in general. So, but if your economy is dictated by a nation many miles away and potentially is still extorting it, it's still manipulating in a way that keeps that nation poorer than it deserves to be, and still benefiting in itself, the colonizing community. How does that impact people on a day-to-day basis? And then obviously that means that they don't necessarily have the ability to make the choices that they would like to make and to develop in the way they would like to develop. And that's, you know, why independent movements happen. So if you can shed some more light on that, that'd be great.
Yeah, sure. So yeah, as you said, you know, we've spoken about this. Senegal is a former French colony, as are a number of countries, sort of across West Africa and Central Africa. In particular countries, you know, we've heard of like Congo, like Mali, sorry, Democratic Republic of Congo and the Republic of Congo. Sorry, Republic of Congo, not the Democratic Republic of Congo, but that was a Belgian colony. Right. You have Mali, Central African Republic. Guinea was a former French colony. And even Djibouti, which is in East Africa, Madagascar as well. And the sort of process of sort of decolonization or the way that these countries achieved independence, these former French colonies, was very different from, say, the former British colonies like Nigeria or Ghana. In those countries, the British basically got up and left. You know, in terms of having a political you know, and direct hands on the levers of power, they got up and left. You know, British companies and multinationals were still and are still involved in those countries. But for the most part, the British sort of got up and left and didn't leave, you know, remnants of colonialism behind. In the case of the former French colonies, there were a number of agreements that were signed on them achieving independence, which maintained or continued colonialism in some forms. So, for example, in Senegal, the currency that we use in Senegal is a colonial currency. It's a franc. It's actually a franc, and that is used in 14 different countries across the continent, used by about 170 million people in those countries. And through that currency, France that currency gives France a certain number of advantages, basically. And it has given them a lot of control over the affairs of those countries, over the economic affairs. For example, they devalue that currency, at their will. It also gives them an advantage in terms of trades, because it makes it's a lot easier for those countries to trade with France than to trade with a country outside of that sort of currency zone, because then they need to sort of do currency exchanges, which then cost. With France, they didn't need to make those exchanges. It's difficult to make a sort of a direct draw a direct line to how people are experiencing the healthcare system today. But I would say that these economic relationships, there are certain business relationships with France, and political relationships with France as well, which mean that the country is not necessarily, people are not necessarily getting the most out of their country, basically. And that has ramifications all the way down. When you look at these countries who former French colonies, they are among the poorest countries in the world. I mean, countries like Niger and Mali are at the foot of the Human Development Index. You just look at them; they're all just sort of queuing up, basically, at the bottom of that index. So that is a sign that these countries are getting a really bad deal. And what does that look like on the ground? So despite this, Senegal still manages to have a public healthcare system. It's mainly for sort of primary care, but it still manages to have a primary a sort of public system, which is interesting, because I'm talking to you right now, and you're in the wealthiest country in the world. The country that has accounts for 25% of like global GDP or whatever, and that's not necessarily the case, right?
It is not. It is.
So that is, I find that really stunning, actually. That a country like Senegal does have a sort of a base. That being said, most people, I've used it. If you've got a job and maybe got health insurance or something, then you would tend to go to the private sort of system. And I've used that, and there are doctors from Senegalese doctors from North Africa, doctors from elsewhere in West Africa, who are very good, very qualified doctors who sort of see to you, sort of there. I guess with Senegal, what's interesting is within that sort of French West African zone, Senegal is seen as the sort of the leading country, right? Despite all of the problems I've just told you,
right.
it is seen as a sort of leading country. So the elites from those other countries would sometimes come to Senegal for their healthcare or for their shopping, or they might have a second home there, and might retire there and stuff like that. So it does have a reasonably developed sort of private healthcare system, there as well. So yeah, and I think as you said, that the recent protests have been recent protests, partly to do with the government's handling of the crisis. But what was interesting with these handling of the coronavirus, the crisis, people are sort of upset that the stringent restrictions are affecting their lives and their livelihoods. And what was interesting was, the sort of protesters, some of the protesters attacked French-owned businesses. So these were supermarkets, these were petrol stations, these were toll gates as well.
Right.
And what was interesting, these were the places where the majority of the population cannot access. These are the places that if you're middle class Senegalese, you can go to the expensive French supermarket. You have a car, so you can buy petrol. You can afford to pay the toll to go onto the exclusive highway. So these were the places that were targeted, and there really is a sense, I think, among many Senegalese that the French influence and the sort of elite, Senegalese elite and French sort of relationship, basically is exploitative, and means that for most people, they have a really rough time.
Wow, it's I think this is something I would really, if I could, talk about for days, because it's I think a lot of those living in the West don't necessarily understand how colonialism has impacted so many lives in so many ways, some of which we realize, some of which we don't realize psychologically. I just think about my why is my father having to leave India to work in the Middle East and to go through the issues and whatnot? Why am I here today in America
Absolutely.
when I come from a historically a very, very wealthy country? And it's fascinating to understand this, and obviously the impact, as you've mentioned, is having on the day-to-day livelihood of people. However, and sadly, we don't have a lot that much time. I really wanted to give you that little bit at the end to speak about your book.
Sure.
Speak about
Yeah. Thank you.
that very interesting character, Kwame Ture. Who was he,
Sure.
and what does your book highlight about him?
Sure. Yeah. Yeah. Thank you. I mean, thank you so much for having me here, and for giving me this opportunity. So, Kwame Ture, is in America, he's probably better known as Stokely Carmichael, and Stokely Carmichael was a major civil rights leader. He was considered sort of during the 1960s on par with Malcolm X, Martin Luther King, and Stokely Carmichael was like the third sort of major icon of that movement. And he was involved in the civil rights movement. Then he became the leader of the Black Power movement. He was also involved in the anti-Vietnam War movement. He was part of the Black Panthers. So he really was, he really lived a very active life in America. But do
you have a copy on hand, by the way?
I do actually. Yeah.
Show the world what it's looked like.
Can you sort of find it? Yeah.
Yeah, kind of. Yeah.
Kind of. Yeah.
Right. Go ahead. Fair enough.
It's not. It doesn't want to.
It doesn't want to work. It's a nice green cover, though.
Yeah. Okay.
Okay.
And in the late 60s, he moved to Africa, to a place called Guinea. And he worked there. He worked alongside Kwame Nkrumah, who was the first president of Ghana, and someone called Sekou Touré, who was the first president of Guinea. And he sort of became an important sort of Pan-Africanist sort of organizer and activist. And my book really follows the time he spends in Africa, basically,
right.
The 30 or so years he spends in Africa, because I think that when we look at his biography, it often ends, and as soon as he leaves America, it's sort of like his life is finished. Let's not bother him. But he lives for 30 more years in Africa, and he's very, very active. So I follow his life in Africa. I went to Guinea, and I went all around, and I spoke to various people, government ministers, and the Sekou Touré, the first president, his wife. I went to Kwame Touré's, he changed his name to Kwame Touré, Stokely Carmichael to Kwame Touré. I went to his old neighborhood and spoke to people there. And, 20 years after his death, people, were talking about him as though he was almost still alive. I mean, he was so present in their, in their memories, and sort of, the kindness, and used to teach children how to swim and all this sort of stuff. So yeah, it was a wonderful time. And yeah, if you can get hold of it, then
where can someone get a hold of your book? Is it on Amazon? Is it on...
Yeah, I think so actually at the moment we're just the first print run have all been sold, and so there's a new print run about to come. I guess the best thing probably is to follow me on Twitter.
Okay.
So just at TJ Amandla. So that's at TJ and then my name Amandla, AMANDLA. That's TJAMANDLA, and then you'll find information there if you're interested.
It will be in the YouTube description for anyone interested,
okay,
which I hope everyone is. Amandla, thank you so much for your time.
Thank you.
On to giving an insight about Senegal, the healthcare, what happened during COVID-19, and then the extensive reverberations. My English is always muddled sometimes, but the impact on the economic impacts, and just straight insight into Senegal and life there and healthcare over there. Thank you again. And thank you, viewers, for sticking around and continue to listening to us and having this conversation. We here at Healthy Mind Chat endeavor to have more conversations like this. And if you have any suggestions, please let us know in the comments. If there's any way to improve this podcast. By the way, I want to let them know, especially for IRS, I don't make any money out of this. This is a side project that I'm doing. As you know, I'm a medical student. I don't always have time to this, so I won't necessarily be regular. But is there as a fun project for myself, and if it benefits people, great. So hopefully I'll see you in the next episode of Healthy Mind Chat. There's so many topics around health and healthcare that are happening at this particular time, and hopefully I'll try to bring that to all of you. Thank you again, and see you in the next episode.
Thank you.